Vince Gutierrez here, physical therapist. You can find me at movementthinker.org. This is another video in the series of how the shoulder moves. We covered vertical pulling in one of the previous videos. Now we're going to cover horizontal pulling. And this is an important movement for opening doors, pulling on something if you're playing a game of tug of war. This is all essentially trying to take the elbow from in front of your body to behind your body. The previous video was taking the elbow from overhead and bringing it down to your body. This is horizontal pulling. This is one of the ways in which the shoulder moves. It can be done with a band. It can be done with machines. It can be done with a barbell. It can be done with a dumbbell. Your mode of doing it doesn't matter. What really matters is that you're doing it, because this will strengthen the muscles on the back side of the body, essentially all of the muscles from the neck down to the hips. Okay? What this is a version of a row, but it's easier to just call it horizontal pulling. And so from this position here, you'll have your elbows in front of your body. You may need to stagger your stance if you're using a band to stabilize yourself, because if you're using a heavy band and you pull, it might pull you. Okay? And so you might need to stagger your stance. And to me, it doesn't matter which foot forward. I hear these small details that people want to discuss. If it's important to you, I would say put one foot forward on one set, switch, and put the other foot forward on the other set. If you feel more comfortable just going with one foot, that's fine also. Okay? We're really focused on what's happening to the upper body with this exercise, not necessarily what's happening to the lower body, and I know it changes. So for all of the other therapists out there, I realize that, but we're looking at gross movement versus minutia down here. And if you really want to, just change it set to set. Okay, so to start the motion, you're going to go with elbows in front of your body. Keep your head up, chest high. Think again, military posture. From this position, your goal is simply to pull your shoulders or pull your elbows behind the plane of your body. Hold for a couple seconds and slowly lower it down. On one of the previous videos, I did not talk about tempo, I did not talk about repetitions, but I did tell you that I am a former power lifter, a former strongman, a former personal trainer. And on this video, I'll give a little bit more detail. What I like to do is 1 1,000, 2 1,000, 3 1,000, 4 1,000, 1 1,000, 1 1,000, 2 1,000, 3 1,000, 4 1,000. I really like slow and under controlled for these motions. Okay, this goes back to Arthur Jones, a little history lesson. Arthur Jones and Mike Mentzer, heavy duty and high intensity interval training, right? They prefer to discuss time under tension. I like the concept. I specifically like the concept when we're trying to isolate movement. We don't want to use momentum as much as possible when we're moving just one joint or two joints and it's a smaller motion. In the bigger motions, such as a clean or a snatch, you might be using that. Different video for a different day. But for these smaller motions, make sure that you're doing it under control. So again, elbow from in front of your body, tall chest, tall head, elbows to behind the body, hold 1, 2, and slowly bring it back forward over the course of 4 seconds. So 1, 2, 3, 4, 1, 1, 2, 3, 4. Now, the way that the shoulder blades should move is you'll see the shoulder blades are rolled forward a little bit in the beginning of the motion, and as you do the motion, the shoulder blades will actually come together as you're pulling back. Just like with the last video that I did, where people have trouble disassociating this motion from this motion. If you're having trouble getting the shoulder blades together, first practice driving your shoulder blades into your opposite side back pockets. Once you've done that, then pull the elbows behind the plane of your body. It's really important that you learn how to move your shoulder blades and your arm separate of each other. Okay? Because some people, they cannot pull their shoulder blades back unless they're pulling their arms back. And other people, even when they pull their arms back, they never pull their shoulder blades back. And so they stayed in that rolled forward position. Again, the shoulder girdle, the shoulder blade, should move freely in all directions with no restrictions. Up, down, forward, back, tilts, and such. And you should be able to get your elbows behind the plane of your body. I personally like to work up to 25 repetitions under that slow, controlled motion. When you can do 25 consecutive, at that point we add resistance. If you can't do 25 consecutive, that's fine. Break them into sets, as many sets as you need in order to get to 25. and then build your way back up again. Increase the weight, build your weight back up. It may take you a while, and it may take you a few cycles to actually get heavy enough to where this becomes therapeutic, where it's actually building strength, but you'll get there as long as you follow that program. Just as every session that you go in week to week, you're trying to do a little bit more than you did the previous week. So live well, move better, live better. Thanks for watching.